This is Julie Crane, and I'm here with Jalea, and she is our case manager. Today, we're going to talk about her role in working with the clients that we serve. So, Harriet's House has an 18-month residential program that helps women survivors of human trafficking and exploitation. So, today, we're going to talk a little bit about what the process is for Jalea when she's working with our residents. So, Jalea, what is the greatest need that you find with residents when they first come into the program?
Okay. The greatest need that I find with the residents is that they need medical assistance and food benefits. So that's one of the first things I do when I meet them.
Okay, so you work with them to fill out the applications and to be able to get the things that they need as they come into residing with us. So, what is your process when working with a new resident?
Okay, so the process, we go through intake, and then there's some assessments that we take just to see how they progress through the program, and then they do, once the benefits are established, we get them appointments with doctors and therapy and really whatever else they need based on their needs. So
Okay. So you talked about assessments. Let's talk a little bit about that. So when you have a new resident, you have different assessments that you do with them. What does that look like?
um okay, so for the assessments, they're just they ask them questions. So there's different ones. For example, we have like a patient stress questionnaire, and that really just gauges their stress level when they first come in. And then we do them like every 3 months and every so often, just to see where the stress levels are at. And yeah.
Okay. So that first initial assessment is just a baseline to find out where they are. And then you're coming back every couple of months to do the assessment again so that you can see their progress. Okay, great. So what else do you do with them when they're in case management? What other types of things are you guys discussing in those meetings?
So we go over just like what they need. So in the first phase, is like the stabilization phase. So within that phase, I just like we discuss what their needs are, and then if they, for example, we have a resident who likes to journal, so I print out journal prompts for her.
So you're giving them some tools
Mhm.
that they can use while they're in the program and allowing them to explore things that they're interested in, right, through case management. So in the first phase, we talked about it being stabilization. So they're getting doctor's appointments scheduled. They're also getting therapy scheduled as soon as they have their benefits. So that's helping them to get that stabilization that they need.
Yeah.
And then as they journey in the program, their needs might change. So if we have somebody come in and she is in need of seeing a dentist, or maybe she needs glasses, you take care of that too? Okay. Yeah. So you're scheduling their appointments, you're helping them to see the benefits that are available. And then how about like in the second phase? What are you focusing on in the second phase?
So in the second phase, we focus on career readiness and education services, whatever they want to do for their education. So whether that's getting a GED or starting a degree program or a non-credit program, we just get that started for them. And then we just explore what they want to do for a job.
Okay. So you're really focusing that on the time that they have with us. So we're an 18-month program. Now, of course, if we have somebody who's in the program and they need to extend to stay a little longer than 18 months, we certainly will allow that. And if it's somebody who can get all their goals met before the 18 months, we keep that into consideration too. So if it's somebody who is interested in nursing per se, we might not get them registered into a nursing program, but do some things that can lead up to that. So what would that look like?
That would look like taking a non-credit course. I think it is a non-credit course that they can just go to like an 8-month program and just get the basis of what that job requires, or just the knowledge that it requires, and then just adding on throughout the time that they're with us. And then as they like leave, we can also or when it's time for them to leave, we can provide them resources to get connected to that that program that they need to establish that career.
Okay, so that's good. So you're setting them up for success along the way, where it's kind of like building blocks, where you're just establishing one layer after another to give them everything that they need while they're with us.
Mm-hmm.
So during the program, they can also start to work.
Mm-hmm.
Yeah.
Yep. It's during phase 3 they start working, and so they can explore like job readiness in phase 2, and we try to just start it out slow, like whether it's volunteering at a job that they might want to work at, or part-time work depending on if they're
What are
ready
the
for it.
greatest challenges that you've seen when working with residents in case management?
The greatest challenge that I've experienced myself and also with the residents is just patience and just understanding that everything has its time, and we have to move at a certain pace, and it's not like you can't get everything right now. So just balancing that.
Okay. So basically, with the patients waiting for things to fall into place, that takes time. We're such a instant gratification society because we've learned how to be that way. That we think that things should instantly fall into place, but sometimes things take time, more time than we expect them to.
Mm-hmm.
So, what have you learned from that also, like in your own not feeling like if you haven't gotten something accomplished by the time that they have their next case management appointment with you,
Mm-hmm.
how does that affect you?
At first, I kind of felt bad and kind of like put myself down in a way, like, because I felt like I was letting them down if I wasn't getting the assignment done. But it's just, there's a time period that, things take time. So I just try to be more patient with myself and not put as much pressure on myself. The residents actually were more patient with that than I was. So they also helped me and encouraged me with that too. So. Yeah.
So it's really about creating balance in your schedule and also making sure that you take time for yourself so that you're not carrying this burden all the time where you feel like you have to be constantly thinking about it.
Yeah.
Yeah. Okay. So in doing this job, what has been one of your, what do you feel like has been the most fulfilling for you?
I think when they get like what they need, like when they are able to go to a doctor's appointment and it's an actual nice appointment, they can get the medicine that they need, and they just have overall like good experience and me just getting what they need.
Okay. So one of the things that you also do while you're in the beginning phase with them is to get their prescriptions transferred over. So if they're using a different pharmacy or something like that, you can help them with that too.
Mm-hmm. Yeah.
And then getting them established with if they need a psychiatrist or someone that can assess their needs for the need for the medication, because that's one of the things that we run into too, is that they need a doctor who will be able to prescribe those medications for them. So have you had any challenges in that way?
I have had a few. Sometimes like we can't get them into a psychiatrist right away, or sometimes it's difficult getting their medicine transferred because of there's a certain process you're supposed to, like if you're moving from one stage to another and you have benefits, there's a certain process you're supposed to go through before you leave, and sometimes
they didn't go through that process.
Yeah, and it can be difficult, but it's just that patience that come in with talking to people and just waiting for it to get sent over.
So do you feel like this job has helped you to hone communication skills?
Yes, for sure. Like you talk with a lot of people, and everybody's not always the nicest, and some people are, they have their days. So it just teaches you to, be understanding and then using the right tone in the words and all the things. So.
Yeah, so honing those communication skills is important because we might be having a bad day and not talk to somebody the right way either. So it helps us to be more understanding, I think, when we're not, when we're in the other end of that. So do you feel like this job has been different than you expected it to be, or
I think it has been, yeah. I've learned a lot. Like, I never worked in a job where I needed to, like, talk with as much people I need to schedule things. Like, I never had a job like that. So I've learned a lot being here, and, yeah.
so collaboration is also important, right? So
Mhm.
there's so many community partners out there that you have to connect with.
Yeah.
So collaboration with other partners is so important. So name some of the partnerships that you've had to collaborate with. You don't have to say their name specifically, but like what different entities have you had to connect with since you've been in this role?
Um, so you mean like doctor's offices or?
Like social services.
Okay, so yeah, social services, doctor's offices, even therapy, that's been new for me. I never really went through that before. And
How about like the college? So you have
oh
to
yeah,
really learn about the programs there and maybe even connect with them on a different level. So, what do you think would be the things that you would have to do when you're working with somebody in their academics?
so we would have to one start early because if you've been to college or if you've been to the process, you know that it's like it can be fast. So if you start early, you can be prepared for it. And also just meeting with an advisor because they know more than we do about college and all the things. So meeting with them and just getting their understanding of it and help through the process and um, yeah,
Yeah,
figure out
so that
finances
way
and
you
stuff.
can help them with their needs as far as the resident goes. Like, okay, they might think, I'm just going to start this program. But there
Yeah,
could be a lot of things in ahead of time that they have to do that they weren't aware of. Like,
yeah.
if they need the placement tests that
Hmm.
will allow them to get into the program, to look at the funding
Hmm.
options that are available, or even prerequisite courses that they didn't realize. So it's really important to be connected to the college and the advisor and all the people that work there so that they can help lead that conversation, because of course we don't have all the answers, but
Yeah.
collaborating with those community partners can help that. You've also been a part of like setting up a table at different events to be able to
Yeah.
get information out for Harriet's house. Can you tell us a little bit about that and how that has benefited you?
Yeah. Yeah, so those are actually really fun. Outreach events and just you meeting different like people in the community that you can partner with, and it's um it's fun. And like you just have to you set up your table and you talk to people. It is a learning process too. That's communication skills. I had to write down on a note card and just like process like just have it written down so when they ask me about the program, I have the words to say and it doesn't sound all jumbled up and stuff. But yeah, it's been fun. You just meet a whole bunch of new people and just make really good connections.
Yeah, so you're able to get community connections like the health department, like
Hmm.
those people are generally at those events
Hmm.
with other organizations that might do something similar, like other shelters
Hmm.
or just community partners that you haven't engaged with yet. So I
Yeah.
think that has really helped to build you as a person too, as able to connect with people that you didn't realize were a resource before.
Hmm.
So yeah, I definitely have seen where Julia has grown by leaps and bounds by being a part, and continues to grow and learn, and is always ready to learn more. So thank you for sitting in with us today for our conversation about Harriet's house and case management and the things that we're doing to help our clients as they come into our program. So keep watching as we continue to post Teaching Tuesday videos. Each week we're going to address a different topic as far as human trafficking is involved, because all the women that we work with are survivors of human trafficking. And so this month we will continue to have more conversations and teachings where we can share with you the things that we do with Harriet's House. So thanks. Have a good day.